necessary that I start right away cutting a CK, but I agree with Sebastian that the first goal is always to stay as low constraint as possible, but as much as needed, and then plan B, always have the CK system stand by.
And interesting was also Bhishma said he had special solutions for patients with high BMI. Sebastian, are you also treating them in another way, patients with high BMI? Do you do more constraint? How do you solve that cases?
I think what I see in patients with high BMI is that sometimes their bone quality is very good and sometimes it's not. I'm not sure Wolff's Law doesn't apply in all cases, it seems, but in patients that have high BMI but seem to have good bone quality when you do your primary cuts, I typically just use primary components and no stems. But there are cases where there are very high BMI patients and their bone quality also seems to be very poor. Their cancellous bone is very soft. And so in those cases, I would use not more constraint, but I would use, more fixation on the tibial side, particularly. That's typically a short cemented stem.
How do you solve it, Michael? Do you do more slope? Do you do special implant positions or constraint systems?
So first of all, it's like with the high BMI, you're always in a little bit for a surprise because you expect sometimes soft bone, they have harder bone, or sometimes the bone is really soft. So my primary worry is to have a good bone implant interact with the cement on the tibial side. That's where the whole strain will go. So additional fixation or even lengthening the station with a stubby or longer cement, I think is a good solution for those patients. I think trying to reconstruct the natural kinematics of a high BMI patient is not always possible, even if the soft tissue is pinching for you. So I'm not sure if I can sometimes solve the issue with hope, but I'm always the most worried, and I think my cutoff personally is like 100 kilogram. Once the patient reach that magic number, I will go for an extension like a stubby.
Okay. So what about cement fixation? So there's some data for high BMI patients.